Welcome to the Chairman's Perspective Podcast.
Welcome to the Chairman's Perspective. I'm your host, Mark Billingsley, Chairman of the Shelby County Board of Commissioners. My hope is that the Chairman's Perspective provides useful information about your Shelby County government and the people, organizations, and programs that make our community unique. Today, I'm very excited to have a very good friend, Dr. Altha Stewart, Senior Associate Dean for Community Health Engagement in the College of Medicine for the University of Tennessee Health Science Center. You won't want to miss any part of this show. We'll be right back on the Chairman's Perspective, powered by the KUDZUKIAN Network.
Inside 901.
Inside 901. I am your host, Lieutenant Anthony Buckner. Here on Inside 901, we will unpack the vision of Shelby County Sheriff Floyd Bonner and the various divisions of the Shelby County Sheriff's Office.
We have a racial profiling policy at the Sheriff's Office. We adhere to it. We expect our officers to adhere to it.
Uniform patrols that provide police services to unincorporated Shelby County.
Inside 901.
KUDZUKIAN! The Chairman's Perspective on the KUDZUKIAN Network.
I am super excited to have Dr. Altha Stewart with me today, Senior Associate Dean for Community Health Engagement in the College of Medicine at UT Health Science Center. Altha, truly it's a pleasure to have you on the show. You've become a dear friend and really a professional in the community that I listen to. I try to pay attention to the issues. Before we get into sort of a deep dive on mental health, a lot of people don't realize with your national and international notoriety, you're actually from Memphis, live in Memphis, were educated in a big portion of your life right here in Memphis. You're a major leader at UT Health Science Center, one of the first women at Christian Brothers University. Can you just give a brief background? Because honestly, and I say it very sincerely, to have an international leader like yourself in Memphis that came back to Memphis after education, it's amazing. So just a brief introduction, if you don't mind.
Well, thank you, Mr. Chairman, and thank you. It's an honor to be a guest here with you today. I try to explain to people I'm just a small town girl from Memphis.
I don't think so. But
I born and raised here, grew up here in the late 50s, 60s, attended public high school right there in South Memphis, Carver High School. And in 1968, transferred across town to Sacred Heart, where I graduated. Went on to Christian Brothers, what was then Christian Brothers College,
right,
in the first class of women who were officially admitted to Christian Brothers College back then. So I guess kind of was a trendsetter even back then. Left Christian Brothers and Memphis at that point, heading north to go to medical school. Attended Temple University in Philly, did my training in psychiatry there, worked there for about a decade, and then moved on to New York, where I ran the New York public mental health system for a few years, on to Detroit, where I ran the Detroit public mental health system. You might say that growing up in Memphis taught me that I like being in charge. So I went on to do those things. And in 2003, my mom got sick here, and I decided to move back to Memphis. And I've been back here ever since. Came onto the faculty at UT in 2015. To create the Center for Health and Justice Involved Youth, which I'm still director of today, and have moved on to incorporate the work of my center there and expanded it to now have the Shelby County Youth Advocacy Center as a part of our program. And we're about to create a new system of care for children's mental health here, led by the University of Tennessee Health Science Center, Department of Psychiatry.
Well, your background is so vast. And when I referenced internationally known, I wasn't joking. You're the immediate past president of the American Psychiatric Association. Just last year, you led 37,000 physicians. What was that experience like? And I have to also mention, you were the very first African-American to lead the organization in its 173-year history. And I'll say that one more time. The first African-American to lead the organization after 173 years. What was that like?
Well, the American Psychiatric Association, or APA as we call it, was actually established in 1844, 3 years before the American Medical Association, which most people know about. So we've been around for that 174 years, and in that time, there had never been a black president. So that was history-making in its own right. And as the largest psychiatric society in the world and the oldest in this country, 37,000 plus members is a lot of people looking up to you for leadership and guidance and being the face of the organization. So I spent the better part of a year in my role at UT as director of that center and bringing on new programs, while I was also the face of American psychiatry in the United States and abroad, attending meetings, representing the field, participating in programs around the world. I was able to visit South Africa, Jamaica, Great Britain, Portugal. I went all around the world talking about mental health and the impact of the lack of mental health services on various people around the world.
You are listening to the Chairman's Perspective on the KUDZUKIAN Network, and I'm so honored to have Dr. Altha Stewart with us today. Dr. Stewart, you talked about your travels this year as the past president of the American Psychiatric Association. We're talking heavily in this country about the status of mental health, and actually today's show is called The State of Mental Health. Mm-hmm. Is it any different in any of the countries that you traveled to? Is it worse, better? Where are we as a world, quite frankly?
Well, I think it's important to put it in perspective. I think it's important that people understand mental health and mental illnesses are some of the top 5 to 10 diseases that everyone in the world deals with. Right now, depression is the number one disease around the world that people are dealing with. And we tend to think of depression as just someone's kind of sad or blue. Sure. Depression is an actual disease of the brain that we can pinpoint where the problems are, and we have good treatments to deal with. In other parts of the world, you'd be amazed at what countries that have one psychiatrist for the entire country are doing to address their mental health needs. There's a lot that the United States can learn from some of these under-resourced areas about how to make better use of our workforce, about how to expand our workforce. There are countries in Africa, Nigeria, Ghana, that have limited numbers of psychiatrists. And so they have armies, literally, of community mental health workers who do lots of things to support the mentally ill in those places. They use nurses and physician extenders in ways that we haven't yet adopted in some respects. There are many, many things we can learn from our colleagues around the world about how to extend access to mental health care to the populations that need it. Right here in Shelby County, we have resources that people can't access, whether it's because they don't have the right insurance or because they don't have transportation or because they don't understand the importance of mental health treatment. There are things we can do that we could expand the access if we are a little creative and innovative.
Gosh, I want to get right back to this conversation. You're listening to the Chairman's Perspective on the KUDZUKIAN Network. We're going to take about a 30-second break. We're going to be right back with Dr. Altha Stewart, Senior Associate Dean for Community Health Engagement in the College of Medicine at UT Health Science Center. Truly not only a local, national, but an international leader in mental health. We're going to take a deep dive into some of the challenges that children and adults are experiencing right here in Shelby County and how Dr. Stewart is helping Shelby County government combat some of these challenges. And so we're going to be right back.
The Chairman's Perspective on the KUDZUKIAN Network.
Hey, I'm Williams Brack, co-host of Grind Set. The insight you gain from us and our guests will motivate you to take the leap into entrepreneurship. Make sure to check us out on Spotify, Apple Podcasts, TuneIn, Stitcher, or your favorite podcast provider.
Grind Set on the KUDZUKIAN Network.
KUDZUKIAN!
I'm your host, Mark Billingsley of the Chairman's Perspective, and we are so excited today to be back with Dr. Altha Stewart, who's the Senior Associate Dean for Community Health Engagement in the College of Medicine at the University of Tennessee Health Science Center. We are very excited. I can speak on behalf of Shelby County government and being the chairman that we're very excited to partner with UT Health Science Center and with you on the new Youth Advocacy Coalition, a pilot program. Can you tell the audience a little bit about that program and how we're trying to make a difference?
Well, we're also very excited to have this opportunity to partner with the Shelby County government, and thank you on behalf of the children and families who are benefiting from this for being willing to be supportive of this pilot program. The Youth Advocacy Coalition is one of the programs that is a part of my center, the Center for Health and Justice Involved Youth. Our goal at the center is to provide a framework and access to services for young people who would otherwise be directed into a system, out of their home, out of their community. And that system could be juvenile justice, it could be child welfare, it could be some out of the county placement for behavioral problem. And what we endeavor to do, and the reason we accepted the contract with Shelby County, was that we wanted to create a service program where children who, by virtue of some behavioral problem, some undiagnosed, untreated mental health problem, some impact of trauma in their lives, or just situationally who were on the path to something destructive in their future, we wanted to have a place where these young people could come, either directly and voluntarily on their own, or through a referral from the schools, the community, a program in the community, a family member, or even law enforcement, if they were not already in the deep end of the criminal justice system. And by that, I mean, for children in school today, if you're being bullied, if you're being expelled, if you're truant, if you're having challenges with your behavior in the classroom, these are the children who are at risk, we call them, for finding themselves on the path to the justice system for any number of reasons. These are the children who may or may not be recognized as needing something that could be provided in a treatment setting. And so the principles that we operate under are it's voluntary, it's restraint-free, it is trauma-informed, it is centered on the family and child's needs, and most importantly for the listening audience, it is not connected to the juvenile court.
Which is really important. Can you share, Dr. Stewart, you and I know the answer to this, but can you share when you hear from parents why that is so important?
Because we have a history, a legacy in Shelby County of the kinds of things happening to children who got directed into the juvenile justice system that people find reprehensible, unfair, criminal, and a whole host of other negative things. And while there has been an investigation with the Department of Justice, which is now concluded, there are remaining feelings about how kids get into that system, what happens to them if they're in that system, who are the people in that system who are disproportionately representative of the African American young black male population. And so it is a legitimate concern that anything that is attached to the court brings all of that legacy with it. And from the beginning, we at University of Tennessee were very careful that we wanted this community to understand that the role we wanted to play was in the service part of this. And that's the agreement that we have with the county around who we serve and how we serve them. And so there is absolutely no connection to my program, the Youth Advocacy Coalition, and the court. We have even gone so far, Chairman, as to say the court cannot make a referral to us directly. Which means the judge can't mandate a child come there as a part of their sentence. It cannot be part of the court proceeding. We handle any child who is there who has a connection to the court can ask us to forward things to the court, but they have the right to say how that happens. We consider this to be protected information, and if they don't give me a release that says you are free to provide this information, I am prohibited by law from doing that. And our other programs where we work directly with the court, we have the kind of relationship where they understand I can't talk about a child who's referred to our program, this Youth Advocacy Coalition. I can't talk about that child. I can't forward information about that child because of the way we've set it up.
Dr. Stewart, I'm so happy you're here on the Chairman's Perspective, powered by the KUDZUKIAN Network. You are also dealing with a unbelievable amount of children that have experienced violence in some part of their life. We've got children here in Shelby County. We have children across the United States and, quite frankly, the world that I know you've seen that have been impacted negatively by violence. Can you share with us, we've got 2 minutes left on this segment. We'll come back in a second with more on this, but how does that affect the mental health of children, their ability to thrive, to learn, to succeed? And what are children seeing?
Well, we know from the media what children are seeing are gun violence, domestic violence, community violence, violence among the young people themselves in school and in their community, the bullying, the gang violence, and other things that kids are exposed to really do have an impact on their overall health and well-being. And I want to talk a little bit when we come back about adverse childhood experiences and trauma and how that specifically impacts child's development, brain development and physical development, such that they are impacted for the rest of their lives.
Do you think social media has taken us to a new place regarding children's mental health and even, quite frankly, adults' mental health?
I think the exposure to what is available on social media certainly has had a negative impact in many cases on children. The number of children, for example, who are considering suicide, who talk about it on social media and who are encouraged via social media to do it, is just phenomenally bad. So there is an impact of social media that has definitely been negative. That we should deal with.
Well, if everybody want to hold on just for a minute, we're going to be back and we're going to take a quick break. We'll be back with more of the Chairman's Perspective on the KUDZUKIAN Network. Today we're with Dr. Altha Stewart, who's the Senior Associate Dean for Community Health Engagement at the College of Medicine at UT Health Science Center. Again, a great conversation going on about our challenges locally, nationally, and even internationally with mental health. We'll be right back.
The Chairman's Perspective on the KUDZUKIAN Network.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on jazz on the KUDZUKIAN Network. KUDZUKIAN!
Back on the Chairman's Perspective, I'm delighted to have a great friend and professional with us today, Dr. Altha Stewart, who's the Senior Associate Dean for Community Health Engagement in the College of Medicine right here in Memphis at UT Health Science Center. We were talking, Dr. Stewart, about the impact of violence on children, what children are experiencing these days, and then their state of mental health and their ability to thrive and learn. We hear a lot of this, but how do you break this cycle, and how do parents deal with a lot of this? Because some parents are struggling with their own anxiety and depression, but then they're challenged with a child that they may recognize being depressed or anxious, or they may not realize. So how do you deal with that? And what are you seeing with our young people?
Well, that's a great question, because it speaks to the importance of awareness and education around the fact that these things are real. That if a parent is struggling with their own experience with depression or trauma or other things, they may be of the generation that says just push that down and push through it.
Right.
And so the expectation is that the child can push it down and push through it. There are things that are at work today that you and I didn't have to deal with when we were growing up. Probably the most important being that social media aspect. Everything is so in your face, fresh right now, that before you have a chance to reconcile some of those feelings or to deal with it and become resilient around it, you've been hit by a flood of things. We encourage people through the work that we do at UT, we encourage people first to get educated and be aware that these are real issues. Mental illnesses are real. These are not just pull yourself up by your bootstraps, snap out of it kinds of things. We wouldn't do that to someone who has cancer or high blood pressure or diabetes. We wouldn't say just snap out of it. We'd offer some kind of treatment. We'd provide some kind of follow-up. We'd give them the best that medical care has to offer. Mental illnesses are real medical disorders. The fact that the organ they impact is the brain is just another part of our history of medicine. The other thing I think that people in the general community who are not familiar with mental illness or trauma or any of those things needs to understand, it's a process that we help people go through in order to impact in a positive way their outcome, being better, more positive. So for a child who's been exposed to violence, for example, you want to work with that child on how they feel about it, on what their interpretation is of what they've seen. Developmentally, young children are different than middle school kids, who are different from adolescents, who are different from young adults. Psychologically, they're different. Physically, they're different. Their understanding and relationship with the rest of the world, including their parents and family, is different. And so you work with the child where they are. You help them to understand within the context of how they perceived it and what it means to them. And then you reassure them that as a caring adult presence in their life, you're there for whatever they need.
Wow. You're listening to the Chairman's Perspective. We were with Dr. Altha Stewart today on the KUDZUKIAN Network, having a deep conversation about the state of mental health. Dr. Stewart, you and I both spend a lot of time at our full-time jobs. Most citizens these days, unfortunately, spend more time, at our careers than necessarily being at home. How do employers deal with, and how do we start a conversation about mental health in the workforce? Because that's where we spend most of our time. But yet there's, I think at times there's people that don't feel comfortable as employers talking about mental health, as well as employees that don't feel comfortable talking with their employers. So how do we deal with that? Because until we spend some of our time, where we spend most of our livelihoods at work, talking about mental health, I have a hard time believing we're going to really fix this.
Well, that's a very great observation, because it's one of the remaining areas where we have allowed stigma to keep us from having these conversations. For most employers, it's twofold. It's, I don't want to get too deeply in the personal lives of my employees, because that's a dangerous, slippery slope to be on. And the other is, if you know something is a problem, you're obligated to do something about it. And in today's climate, the insurance coverage for mental health is not on par with physical health. Even though we have federal parity laws on the books, the full implementation has not yet occurred. And we're working on that. I mean, each state is handling it differently, but there are still some challenges with that. The other thing is, employers don't ask a lot of questions in the area of mental health, and in terms of the benefit package, or what the impact of someone who's having mental health challenges is having on the bottom line, until there is that impact on the bottom line.
Right.
And in the work that we do at the national level, groups like the American Psychiatric Association, we have actual programs to help employers understand how to start that conversation, how to encourage them to factor in what they are learning into the best benefit for their workforce, and then how to spread the word among the workforce that it is covered under the Americans with Disabilities Act. These are, again, medical problems. Mental illness, depression, anxiety, obsessive compulsive disorder, ADHD, substance abuse even. These are all things that are covered under the ADA. And so the individual employee needs to understand that having the problem is not grounds for dismissal or termination. And the employer needs to understand that it's in their best interest from the bottom line. If this is a good worker, you want them present, you want them productive,
Right.
you want them to have the right attitude so that the workplace itself is not toxic. So there are programs out there. The American Psychiatric Association has one to help employees learn these things. Most of the major companies now have taken on this as a part of the package of things that they work on.
Let me ask you this, because we have a limited time. If someone out there who's listening tonight is struggling with a mental health issue, they've got anxiety that is really affecting their ability to wake up in the morning, depression, they're struggling with some type of issue, what resources can they seek out locally? Or what's the best advice for someone who feels like they're struggling?
Well, if it's a child who's one of the children that I was describing as being at risk, I would encourage them to call the Youth Advocacy Coalition at 901-448-4200. And that's for children who are having problems in school, problems in the home, problems in their community with being exposed to violence, being involved in delinquent behaviors and those things before it gets to the point where they're picked up and taken to court. For adults, any of the local mental health providers that can be located through like Link 211 can be called, and services are available there.
We're going to be right back with Dr. Altha Stewart.
The Chairman's Perspective on the KUDZUKIAN Network. The KUDZUKIAN Network presents Cities Now with Carol Coletta.
I'm Carol Coletta, host of Cities Now, a brand new show hosted here on the KUDZUKIAN Network. With Cities Now, we want to help listeners make smart decisions for their cities.
Pittsburgh, Pennsylvania. Little by little, the city is rebuilding itself with businesses such as urban farms and breweries.
We'll interview the sharpest people on the thorniest issues facing cities now.
Cities Now, part of the KUDZUKIAN Network.
This has been a wonderful show today, and I hope this information is giving you a better understanding of the state of mental health. We're with Dr. Altha Stewart. Before we wrap up today, Dr. Stewart, I want to be sure that the listeners that have listened today really have a way to reach out if they are struggling, if they've got a child that's struggling, if they got a brother or sister who's struggling. How can they reach out and get some help locally?
The number for our Youth Advocacy Coalition is 901-448-4200. 901-448-4200. That's for young people 12 to 17 who are having problems in school, problems in the community before they get to the delinquent point of being taken to juvenile court. For adults, they can also reach out to us at the University of Tennessee at 901-448-2400. 901-448-2400. That is our on-site at the university clinic program for adults. And depending on the nature of the problem or what kind of coverage they have, we may be able to serve them there. And then for generally the public, there is the services that are accessible through 211. All of the mental health providers in town are there. All of the special organizations, depending on whether it's trauma or adverse childhood experiences or school challenges or other things, all of those resources are listed there.
This has been a powerful show today. I hope the information gave you a better understanding of the state of mental health. It's truly been my pleasure today to have Dr. Altha Stewart, who's the Senior Associate Dean for Community Health Engagement in the College of Medicine at UT Health Science Center right here in Memphis, Tennessee. Our Shelby County government is working day in and day out to address the challenges of public safety, healthcare, economic development, and education with organizations like UT Health Science Center. I also want to send a very special thank you out to all of our Shelby County employees and elected officials. They are truly some of our country's best public servants. We've had a great show today with Dr. Stewart. We want to continue to encourage you to listen to the Chairman's Perspective and the Commission in Action 2.0 by downloading the KUDZUKIAN app or by visiting your favorite podcast provider. Until next time, I'm Chairman Mark Billingsley, and you've been listening to the Chairman's Perspective, powered by the KUDZUKIAN Network. We'll see you next time.
The Chairman's Perspective Podcast. Executive producer Shelby County Commission's Chairman Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.